we can. We're gonna come just like this. Just relax here, loosey goose.
Yep.
All right, go ahead and do it. All right, we're gonna restore the cranial sacral pump here. You're gonna breathe in, point your toes up towards us, and you're gonna increase the pressure on your tongue. You can hum on the exhale, it releases the vagus nerve. Inhale, toes, tongue. Let it go. All right, so you were here 2 years ago. Let's recap on some of that stuff, okay? Then we had a diagnosis of scoliosis at 15 degrees. Have you had that re-x-rayed at all?
I have not.
We had a couple of other things happening too at the time with migraines. There was some digestive stuff as well. So let's start with some easy stuff, back pain and neck pain.
Same issues, but I have a diagnosis as to what is wrong with me. I found out that all of the pain and everything is actually caused by a disease called Ehlers-Danlos syndrome, which I have, and then I have comorbidities of POTS, and then I also have mast cell activation disease and gastroparesis, which is a partial paralysis of the stomach. My body thinks it's allergic to things that it's not. So I'm not allergic to stuff, but my body thinks it is. So it can be environmental, it can be food related. I don't have a lot of environmental triggers. My big one is Yankee candles. If someone's burning a Yankee candle, like my lungs start to cramp up and I have a really hard time breathing because my body thinks it's allergic to it when it's not. Gluten in foods, white potatoes, white rice also trigger my mast cell. So I get hives, I get really itchy skin, I get sweaty, my lungs, I have bronchial spasms, so the bottoms of my lungs really cramp up. I can also have esophageal spasms, which is like a mimicking of very mild anaphylaxis. So my throat will close and release, and close and release for days. I actually have to go to urgent care to get like muscle relaxant shots to make that stop.
Okay, how often?
My last one was over the summer. That was right before my diagnosis. Now that I have my diagnosis and I have my management of my various diagnoses, life has gotten a lot easier. I very rarely have those issues, but I'm also on like medications like Singulair, which is an asthma medication, which helps open up the bottoms of my lungs. So that way when I do have a reaction to something, it's not nearly as bad or as painful.
Okay. All right, do you take any other medications?
I take... I think starts with a Z, but it's for nausea and for digesting my food properly. And then I take Claritin every day too to help with like the hives and the itching and stuff. So that way if I come in contact with something that would set off my mast cell, again, it's like not as bad.
All right, do you take any vitamins, herbs, or minerals?
My mom has me on turmeric.
Oh, your mom is the yoga teacher.
Yes, it's
Okay.
my mom, the yoga teacher. She's like, you need turmeric. I'm like, it really doesn't. It doesn't really do much. I notice a little bit of a difference, but it's natural stuff.
You don't take any vitamins or minerals?
No.
Okay, that's an easy place to start.
Yep.
Congratulations on the gluten-free lifestyle. It's wonderful for you. I know it's not easy all the time.
It gets so tempting because I'm like, pizza. But I do like the cauliflower pizzas and stuff, which are
Oh
good.
yeah, they're good. Mm-hmm.
Yeah, they're very like comparable.
Now first, I know you're hypermobile, so there's a lot of things that you crack on your own, and I'm going to observe you cracking your entire spine. So that if there is something that's very stuck, which sometimes happens with hypermobility, then we can isolate that one thing that's very stuck and alleviate that. But then also the abdominal wall and the mesentery, all the things that hold the organs together, they all connect to the body wall, which connect to the skeletal system. So we'll do some very gentle reflexes around the skeletal system to try to decrease the tension that you have here.
You know, like last week I was in bed almost all week due to a very severe subluxation of my hips.
Does your digestion ever take you out for a week? Does
Yes.
your dizziness, headaches, does that still take you out for periods of time?
It can, yeah, when I have flares, and I will, like I described it, like I will go from like one day being totally fine, able to do all the things, to like being in bed for like 5 days straight because I'm dizzy and I'm really tired and my stomach is cramping up.
Okay. All right. That's fair. All right, so are you taking care of your mental health through all this?
Yeah.
All right, I'm going to watch you walk. We'll do a gait, and then I'm going to watch you crack your back, and then we're going to figure out what else I can do for you, okay?
Okay.
All right, last time we did have eversion bilaterally on both sides, and there wasn't any genu valgum or genu varum, but the gait has changed comparatively to the last time. I'm definitely seeing some crossover of the right hip wants to come over towards the left.
Sir.
Definitely an inversion on the left. It could be a double EX pelvis, and that would A double EX pelvis would be indicated with hypermobility. So we'll check for hypermobility and then assume EX postural rotations based on what the feet are telling us right now. Looks like a high right hip from there. Your arms relax. And a high right shoulder, high right ear. Okay, you can stop right there. That's good. Okay, let your arms relax. Good. Okay, we definitely have a higher right hip in the standing position. High right hip in the standing position, high left shoulder. We had a C curve in the lumbar spine last time. And there was a slight scoliosis. We can recheck that. Still feels like there's a rotation in here. I can feel the curve right there. And then the sacrum is tilted this way. Okay, I'm going to look at the bottom of the glute folds, okay?
Okay.
Tracing up to the bottom. It looks like it's very close to even, but we are higher on the right, lower on the left. That's with the high right hip, a higher right glute fold there. Okay, palpating the glute, top of the glutes here with increased hypertonicity on the right. This is showing hypertonic here. High right shoulder, and she's rotated that way. I'm going to look for this birthmark here. Your hair is very thick, it's hard to tell. No birthmark, that's a good sign for MTHFR. Now let's do this. Go ahead and stand up nice and straight, and then close your eyes. Okay, looking for postural sway here. Last time it was back to the left, back to the left. It's the same exact as it was 2 years ago. Back to the left, back to the left. Okay, you can open your eyes. All right, so you crack your own back, right?
I can, yes.
And your neck too?
No, I don't do the neck. The neck scares me.
Okay. How often do you crack your back?
Probably say like once a week. Now that I'm not in physical therapy anymore, and I use a foam bolster, and I'll just roll it on it and really extend up, and it just like crack, 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 like a little Rice Krispie.
In your mid back. Mm-hmm. What about your low back? Do you twist at all?
Yeah.
All right.
And I do like this thing where I put my leg up and I lean forward and it goes crack.
Yeah. Okay, that's true. Okay. And have you done those recently?
Not in a couple of days.
All right. Why don't we do some of those very gently? So you said you did a standing one?
Yep, I do a standing one.
All right, hold on. Before you do it, I want you to really pay attention to where it cracks, okay?
Okay.
All right, go ahead and do it. All right, so that was your sacrum. That was down here?
Yep.
Right or left? Did it feel more right or left? You felt it up here.
Mm-hmm.
All right, so what just happened was you just stood on your left foot, right?
Mm-hmm.
So you stood on your left foot and you raised your right one back, okay? And so that compressed, so your hips are turned out in an EX formation. And so you compressed your sacrum back on your ilium. There was one crack there of the left SI joint, okay? Do another one. Not as significant on that side.
Yep.
All right, 2 little cracks versus 1 big clunk.
Yeah.
Okay, and then do you lay and twist?
Sometimes, but I usually don't get a crack out of that one.
Okay. All right, so that's good to hear. So even with hypermobility, you don't seem to have a excessive cracking. Okay, I'm gonna lower this so I can see your SI joints, okay?
Okay.
All right, right or left, which is more tender?
Right.
Right or left, which is more tender?
Right.
Wow. I just saw something I've never seen. So crazy. So if you look at the top of the gluteal cleft, like the fold, right, and you squeeze the glutes together, it shows you which way the bottom of the curve, which way the spine is tilted, your sacrum, and yours has a double curve in it, like a scoliosis does. I've never seen that before on a scoliosis. That's crazy. All right, so we are upper right, correct?
Yes.
And lower right or left or both?
Lower right.
Lower right or left here?
Lower right.
This right one here feels like it's jammed up. This left one over here feels like it's extremely loose. So the left one was the big clunk.
Mm-hmm.
The right one was the one that was little crunks. Okay, so that indicates right SI joint. So let's do this. Go ahead and turn to the left. I'm going to push right here. I want you to compare this feeling right here, 1, 2, 3, with this feeling over here. Turn to the right. Ready? Mm-hmm. 1, 2, 3. How did they feel? What was the difference? Which side was easier or the same?
This side was easier.
Going to the right, so we were restricted in the left range of motion. So we're going to look for a lumbar rotation there as well. Left short stays short. I'm going to bend your legs, okay?
Mm-hmm.
Left short stays short was last time. Left short stays short is this time as well. That points to a right-sided AS. Right-sided AS matches up with the higher glute that we saw on that side too. The right side is the tender side. I'm going to push down and into the SI joint here. Do you have any pain or discomfort when I push there?
No.
So there was a nice big clunk when I pushed onto that right SI joint. So that means the SI joint on the right clunked 3 times. That last one. That felt pretty squishy too and also hypermobile. So I'm not suspecting that these SI joints are terribly stuck. Let's check on the left side. Do you have any discomfort tension there?
No.
Okay, now raise your right leg up into the air. Down, left, down. Which one is more difficult?
Left.
Left one had one big clunk. There should be 2 more left. 2 more clunks there. And right, down. The left lumbar is okay. The right lumbar is the one that's saying no. Okay, ready? We're going to show the differences in the tenderness here. So this is in the sulcus and in between the transverse process and the spinous process. Spinous process, transverse process here. In between, okay, ready? Mm-hmm. Right or left?
Right.
Okay, ready? Right, left.
Left.
Pushing on the left spinous makes it worse. That tells us that it may be a PL here on this left side. Curvature is this way. It doesn't want to flex this way. All right, so let's palpate the SI joints. One big clunk over here. This one clunked 3 times, this SI joint. I think this SI is done clunking. There might be more in this left SI. We have to do a lumbar adjustment. All right, so coming in from the PSIS right here, we're going to trace right into the SI joint. And we have the divot on this side. So that confirms that posterior inferior rotation, the short leg, higher glute. But there was a higher hip on the right, which doesn't match in this case, but that's okay. All right, I'm going to palpate the ishiotuberosity, okay, the butt bone?
Yeah.
Okay, ready? Right, left, right, left.
Right.
So this one is the anterior side, so we'll have to adjust this coming back this way from the ischium with an ischium contact. Left was the decrease in the sacral extension test, so we definitely are going to look at this left SI joint. We're going to adjust here. Let's see. Is it 1, 2, 3, 4? Which is the most tender?
4.
All right, so a lower SI joint on a PI side. All right, so checking for an IN this way. Okay, you don't have any IN in here. This is free and clear, which usually means that there's an external rotation restriction, and there certainly is tense on both sides. More on the right, left, or center?
Right.
More on the right. So more externally rotated on the right. Right there, stop. Okay, very good. 1, 2. Tell me where it's most tender. 1, 2, 3, 4, 5, 6, 7.
5.
5. 95, 84, 73. So that's T7, L3. Yeah, that's where the apex of your curve is at L3. So we'll have to adjust the lumbar very high. All right, so let's start off. Let's just get rid of some of this like normal, easy stuff that you can get rid of, okay? Mm-hmm. Very gently. Let's go like this. Let's bring your arms up to here. Other arm too. Gentle, Darian. I'm just going to follow your breath down. A very gentle little push here, okay? Okay, let the shoulders and back sink in as gently as I possibly can. We're going to come just like this. Good. That was a little higher than 5. We'll have to go back down. One more. Very nice. There's one more here still. Let the shoulders relax a little bit deeper this time. Good. Okay, so the curve goes like this. Good. Good. One more here. Good. Okay, 1, 2, 3, 4, 5.
4.
Yeah. That's this right here.
Mm-hmm.
Because we're just going to hold on to this TP and L2 and C5, C4. Okay, that one. 5, 4. This is probably looking at L2 or L3 is some variation for your spine. There. Nice gentle breathing. How's this feel better down here?
Yes.
A little bit up there, so. Yeah. This is a third TP transfer. This is actually, this is reflex point for your liver, so we'll have to work on your liver on the other side.
Yeah, everything up in my right shoulder area is like mad messed up. That shoulder also really likes to sublux on me.
Mm-hmm. Yeah, it's the gastroparesis.
Yep.
Oh, that's all related. There's probably some top of the right hip stuff here too. All right, I'm gonna bend this top leg like this. Okay, I'm gonna scooch it forward here just a little bit like this. Okay, we're gonna come back here like this, just a little bit. Okay, nice and gentle, Darren. I'm gonna adjust the very lower part of the SI joint. So here's the S2 right here. Middle, lower. Here's the middle right here. Your spine is off to this side like this, and this hip is open like this. So we have to, I'm gonna use my leg to close this back up this way.
Okay.
We already had one big clunk here, so there should only really be 2 left. Okay, let's give that a try here. We gotta really come from this way. Okay, now, nice and gentle, take a deep breath in and out. Shoulders relaxing, coming up this way right here. Good, right there on top of the joint. Okay, lay on your back. Hold this crouch and then lean back. Breathe out. Breathe.
That went.
Yeah, it did. Okay, let's count it. L3 is here. Let's find the restriction. L2, 3, 4, 5. Here. Nice and gentle. We have a body rotation away from the side of iliac dysfunction, so we have to come in this rotation like this. Okay, deep breath in and out. Shoulders relaxing. Good. There's more. Bring you back. Mm-hmm. So you do everything that you possibly can to feel the best you can without having to own anything. And on the days that it's bad, just know that it's okay for it to have a bad day. And to have people and things that you need and do for you that make you better. That's what it's all about.
Yeah.
To have some doctor or someone, maybe the massage, maybe the physical therapist, you know what I mean? Just like, if you're dealing with emotional, intellectual aspects of all of the illness, or the ill feelings, we'll call them. Let's not own it as an illness. It's something that exists in your body. Let's not just like say that it's there permanently. Let's just know that it's something that you're working with, loving with, but that something is you. And that's a beautiful thing because you have all the medicine right here too. But if you're feeling like emotional, mental about it, and like being able to accurately assess that and then say to your PT or say to someone who's working on you, you know, I've had a lot of difficulty with this emotionally lately, and then to have that as an outlet, then it's that's what they do. That's what we do. That's what healers do. Your friends, even though it's good for you, they don't know how to handle that, obviously. Some people are very intuitive with their emotional intelligence, and they can just do it for you. But a lot of people, it puts them into a position of feeling bad, and you don't want people to feel bad. You know what I mean? You want people to understand and to help you take the next step. Cervical evaluation. Go ahead and turn your head to the right. Makes it even. Back to center. Your head is slightly off, rotated right now to the left. You feel straight right now?
Yep.
So you have a left rotation just like you did when you were standing. Okay, now turn to the left. It improved it slightly. Go back to the center. One more time, turn to the right. Back to center. Left. Back to center. It wants to go to the left, so that head rotation in the left is actually your head trying to compensate, keep your head on straight. Let's do this. Turn bring your right ear down to your shoulder. Back to center. Left ear. Back to center. Upper right, lower left.
Okay.
Nice and gentle breathing, sinking over here like this. We're going to give this a little push in this direction like that. Good. That was okay. It was a little tight. There's a little bit more left in there. Should be 2 more little ones. Let this relax here, loosey goose.
That sounded funny.
Just C3. You have edema over multiple. Let's see, here's 2, 3, 4, 5. Which is the most tender? Ready? 1, 2, 3, 4, 5.
5.
5. C2. So we are in that C2, C3 range. Okay, nice and gentle sinking. Good. We're going to come over here like this and let the shoulders and hips relax. Good. Gentle. As gentle as I can. Nice and gentle. Good. That was okay, but I slipped just a little bit. There's still a little bit more. You're doing good. Let your head drop, shoulders drop. Good. Good. Loosey goose here. Loosey goose. Good.
The shoulder twitched after that one. I was like, whoa.
Crack your toes.
Okay. Yeah, those crack really easily.
Loudly too.
Yeah, the hunchback toes go easier. That one's not hunchback.
Relax. Back out. Gentle. Gentle. Outside. All right, first I'm going to check the ileocecal valve, okay?
Okay.
Okay, we find the valve by finding first the umbilical and then the ASIS right here. We connect these 2 points. It's 2/3 of the way towards the umbilical. So the valve itself should be right here. This is tender for you, I can tell. The reflex for this point is here. Is this tender as well?
Yeah.
Is that one tender? Okay, so we're going to start on the valve itself, okay? The other contact reflex point is at the humeral head at the shoulder. This is all related, all your shoulder stuff.
Yep.
This is tender right here, right?
Mm-hmm. Yeah, that's the one that likes to pop out of its place.
All right, well, we're just going to help relax like the whole system because it's not just your shoulder. It's like your body's entire like morphological compensatory thing that it does, which is beautiful and perfect.
With all the connective tissue stuff.
That's right.
Connective tissue is like the glue.
That's right.
When the glue doesn't work right, everything else kind of like slips out of place and isn't where it belongs.
Mm-hmm. Okay, that's very good. The interesting thing is that stability is not necessarily. This is nice. We're getting some good movement down here. You're very relaxed. It's good. Hypermobility isn't always necessarily just a tissue. So not talking about Ehlers-Danlos, but just hypermobility. I mean, you can take an X-ray. They did a study with NHL players. They like MRI'd all, like 100 of them, and they all had dislocated shoulders.
Oh, wow.
Right, or like people with ACL tears. You know, ACL could be gone. Excuse me. The point with these studies is that they show that you can regain stability with muscular contraction and muscular tone and tension. How's this feel over here on the shoulder? Is it still tender?
Shoulder's okay, it's just still tender there. I feel like that might be C-section related too, because I did have 2 C-sections.
Yeah, if you have a cesarean, you just have to do the technique for longer.
Yep.
It's related, but it's still scar tissue, connective tissue related.
Yep.
You can still work on it related. You know what I mean? All this stuff is workable here. All right, so with the cesarean, let's just come down one more reflex point, pass into, the uterus is in the center, it's in the midline here, so we're going to move towards the midline, but first we'll just, this guy is tender right here too, right?
Mm-hmm. I feel that up here.
All right, cool, thanks for pointing that out. We'll come up to the costal margin, we'll find a point here. This is right at the tip where the lung reflex is.
Yep. The good old bronchial spasms.
Okay, we're going to check the liver.
Okay.
Okay, this is the third costochondral junction. So we're in the midclavicular line here. Okay, we're going to come 1, 2, 3. Tender, right?
Mm-hmm.
Was this one more tender?
Yeah. All right.
Okay. So now we're going to find this exact corresponding spot on the left, on the rear. So attached to the third rib.
My ribs like to move too. I have the slipping rib syndrome.
Right there. That guy. Okay, deep breath. That's better. Does it feel better back here?
Mm-hmm.
That's good.
I felt it let go.
That's nice. can now switch positions. We still hold the liver. We're not done with the liver yet. We'll come down to the liver reflex. Okay, this is another rib manipulation here. There we go. Did you feel that?
Yeah.
That's your gallbladder duct.
Oh,
It's
wow.
just... Do you relax here? Is tender in here?
Yeah.
Is it still tender in here?
A little bit, yeah. Not as bad, though.
This one right here.
Mm-hmm.
This is this is still ileocecal. There it is.
Ah.
All right, it'll get better. We're gonna come up to the gastric reflex point here. No, excuse me, this is the gallbladder reflex point. A little better in there?
Yeah.
Still tender?
Not as bad. Tiny, tiny bit, but like not nearly as where it was.
This one tender?
Yes.
Okay, this one's for the stomach, so this is 2 inches above the belly button. The landmarks don't work quite as well on you because of the curvature.
Yeah.
Your brelar sphincter is an inch lateral. What was that? You had gum in your mouth?
No, that was
Your
me
jaw just
exhaling.
cracked? Oh. Did your jaw just crack?
It might have.
Oh. Did your jaw give you issues?
Sometimes not too bad though. It's crazy how everything is all connected.
This feels better.
Yeah.
Your hands down here. All right, so this one's for the adrenal gland now. Let's just see. So the adrenal contacts are here. Tender?
Yeah.
Down in your belly feel okay down here?
Mm-hmm.
Right, left?
They both feel the same. The pressure point up here, though, is like, ow.
Yeah. You're doing good. Keep breathing. It's okay. You're good.
Jiminy Christmas. My ribs are crazy.
It's the right side more than the left, right?
My ribs also like to float around and socialize where they shouldn't.
All right. So let me just come back to the pancreas again.
I feel like that's in spasm.
Okay, let's just gently breathe into your belly.
I can always tell when something's in spasm because it hurts up here. Like anytime like I get touched anywhere and like it feels like it tensed right here, I'm like, yep, that's in spasm.
Okay, thanks for telling me that.
Mm-hmm.
Gentle breathing into your nose. Good. This time, breathe into your belly. Good. This time, do it into your nose, into your belly. No. Into your nose, into your belly. There. Yeah. Push your belly out. There you go. Now breathe out. Let it all go. Breathe in. Push your belly out. Whoa, dude. You just dropped into some crazy meditative breathing. Your whole rib cage just relaxed. That was nuts. Whatever you just did, you should figure that out and do more of it because your whole rib cage just went from way up here to way down here.
Decompressed. That's what I mean by like my ribs, like they like wander up. And they go up a couple levels where they don't belong. They want to socialize with my neck apparently. And my shoulders.
Let's say if you feel like a sequel liver, gallbladder, pancreas, adrenal stomach, okay.
That's odd. I feel the pressure down here.
What?
I feel like the pressure like here. Like down towards my C-section.
Okay, place your fingertips on your pubic bone. Okay, is it more tender, left or right?
Right.
All right, let's slide your fingertips up to like here and then reinforce there. Tender?
Yes.
Go down a little bit, just a smidge. Tender?
Yes.
More here or less?
Less.
Go back up a smidge. There you go. Okay, now breathe into your belly. Good. I'm going to contact the L5 here.
Okay. That's what I feel in my hip too.
Where?
On the right side.
Like on the back or on the side?
On the back.
Okay.
It's like bowling ball pressure.
Right now?
Mm-hmm.
Where your heel is hitting the table? Or where your butt's hitting the table?
Yeah.
Okay. Like your sacrum tailbone?
Yeah.
And when I go like that, it decreases?
Yeah.
Or if we go on the other side of the spine, we go like this.
No, I don't feel it.
Why did I adjusted your...
Because it's goofy.
It is a little bit goofy.
It's
actually, right now.
it's whack.
Let's see,
As the kids would say, it has no drip. These kids, they say the wackiest stuff now.
Still tender?
Nope.
Still tender?
Nope.
Wait, hold on. Still tender? Yeah.
A little bit, yeah. There's some resistance there.
Push your belly out all the way. Keep going. All the way. Push it out. Now suck it all the way in. No. Breathe in, but push your belly out. Breathe out, suck your belly in. No. Breathe into your belly. Yeah. Now breathe out. Breathe into your belly right here. Breathe out. Breathe into your belly here. And out. That was nice. That's nice. No pain there, right?
Yep.
Did you feel it all the way down?
Hmm?
How far down did you go?
What?
Did you feel it all the way down?
Yeah.
That range of motion in your neck again. Yeah, this occiput is really locked up here. Your shoulders go. Let it go, let it go, let it go. Let it go, let it go. There you go. As he goes. Shoulders. That's nice. All right, we're going to restore the cranial sacral pump here, okay?
Okay.
So you're going to do 3 things at once. You're going to breathe in, point your toes up towards us, and you're going to increase the pressure on your tongue. So you just like suck on your tongue.
Okay.
Right? So breathe in, suck on your tongue, point your toes. Now do that with the in-breath now. Good, now let it all go. Let your ankles go. Inhale, toes, tongue. Let it go. Inhale, toes, tongue. Let it go. Inhale, toes, tongue. Let it go. Let it go. Good. Inhale, toes, tongue. Let it go. Good. Inhale, toes, tongue. Let it go. 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 You can hum on the exhale. It releases the vagus nerve. Inhale, toes, tongue. Let it go. Good. Inhale, toes, tongue. Let it go. It's really nice. Do it again. Inhale, toes, tongue. And out. We're going to do 10. Inhale, toes, tongue. Out. It's 5. Inhale, toes, tongue. Out. Inhale, toes, tongue. Out. Inhale, toes, tongue. Out. One more, I lost count. Inhale, toes, tongue. Out. Okay, vagus nerve stimulation is midclavicular line. Here. You getting cold?
No. My nerves just get the... I'm not even cold, it's just my shoulder, like, doing its thing. Whatever it is that it's doing, I don't know what it's doing.
You have a type of thoracic outlet syndrome.
What's that?
All it means is like because of the Ehlers-Danlos and the loose ligaments, the nerves and the vessels, the blood vessels that go down your shoulder are susceptible to compression here. So like when your shoulders and your rib cage start to move up and do that whole thing, it pushes on that.
Yep.
Straight. Good, and then close your eyes. Back and forward, open your eyes, but not as much to the left.
No.
which is good. That means that's not a category 2. We rewound it back to a category 1. All right, so that's fantastic.
Do you get anybody who doesn't sway, who just like rock?
Category 3, neurological impingement.
Oh.
Good question. No one's ever asked that ever. All right. Which elbow is Offer's elbow?
This one?
Oh, that's relaxed here. Good. Relax. Look straight ahead. Good. Let this elbow relax. Good.
Ooh.
Magnesium.
Magnesium?
Solgar chelated magnesium is an easy start.
Okay.
And you eat meat?
Yeah.
Okay. A general 1 a day, obviously, is probably the easiest thing to start with.
Okay.
Yeah, I would do a general 1 a day magnesium, and then maybe think about vitamin D in the wintertime, or now spring vitamin D levels are lowest, and a fish oil unless you eat fish 3 times a week.
I do not eat fish.
All right, I'm gonna write these things down in order of importance. You don't have to go out and buy a bunch of supplements, because I know it's not part of your lifestyle right now, and so it's sometimes you have to like walk into them.
Mm-hmm.
Slowly, and also you want to know which one feels and is helping, so you can wait to see how you feel and take one at a time, right?
Right, don't
take a
hammer
bottle.
all.
yeah. Go through a bottle. Now some of them take longer, like fish oil really is a long-term imbalance thing, but fish oil and vitamin D, yeah. So let me write those things down for you, Darian, and then let's just see how this adjustment treats you. You know, you're in pretty good shape today. You're not in a flare, but if you get into a flare,